Stop reaching for the same bottle of vegetable wash you've used for 20 years, because right now, it is not enough. I know that sounds dramatic. I know you've heard wash your produce your entire life, from your mother, from the news, from every nutrition pamphlet in every doctor's waiting room you've ever sat in. But there is an outbreak happening right now across more than half of this country, caused by a parasite so small you couldn't see 100 of them stacked on the head of a pin, and washing your lettuce under the tap will not stop it. I'm going to tell you exactly what it is, why it is hitting people over 60 harder than anyone else, and the six things, ranked from least to most important, that actually protect you. Stay with me until the end, because the very last one is the piece almost nobody is talking about, and it has to do with something sitting in your refrigerator right now. Here are the numbers, and I want you to sit with them for a second. As of this month, the CDC has confirmed 1,645 domestically acquired cases of cyclosporiasis across 34 states, with more than 5,000 additional cases still being investigated. Compare that to this exact same period last year, 249 cases. That is not a small uptick. That is close to a sevenfold increase in a matter of weeks. 9% of confirmed patients have required hospitalization. The Michigan Department of Health, working with the CDC and FDA, traced one large cluster, over 1,600 illnesses, packed to shredded iceberg lettuce served at Taco Bell locations in Indiana, Kentucky, Michigan, Ohio, and West Virginia, supplied by Taylor Farms de Mexico. That supplier has since pulled all iceberg lettuce sourced from central Mexico off the US market. This is not a rumor. This is not clickbait dressed up as health news. This is a CDC Health Alert Network notice issued this month, and I'll leave the exact link in the description so you can read the primary source yourself. Before we go further, I want to ask you something, because I read every single comment on this channel, everyone, and I mean that. Tell me your age, and tell me this: have you or anyone in your household had a stretch of stomach trouble this summer that you just chalked up to something I ate and moved on from? I want to know, because what I'm about to describe fools people constantly, and it fools doctors too, especially when the patient is over 60 and everyone, including the patient, assumes it's just their gut not being what it used to be. So let's talk about what this actually is. The parasite is called Cyclospora cayetanensis. It's a single celled organism, and it spreads through what's politely called the fecal oral route, meaning contaminated water, or, far more commonly in the US, fresh produce that was grown, washed, or handled in conditions where it picked up trace fecal contamination. Think of it like a delivery truck that picked up the wrong package at the warehouse. The truck, in this case, a head of lettuce, a bundle of cilantro, a clamshell of raspberries, looks completely normal on the outside. Nothing about it smells wrong, tastes wrong, or looks wilted. But it's carrying microscopic cargo that, once it reaches your small intestine, sets up shop and starts causing chaos. The CDC's own language for the primary symptom is blunt, watery, sometimes explosive diarrhea. Not the kind that resolves in a day or two, like a typical stomach bug. This one follows what doctors call a remitting relapsing course. You start to feel better, you think you've turned the corner, and then it comes roaring back a few days later. Untreated, it can drag on for weeks, sometimes over a month, with weight loss, fatigue, bloating, and loss of appetite riding alongside it. Now, here's why this hits differently after 60. And I want to explain this the way I'd explain it to my own patients without the jargon. Your immune system, as you age, undergoes something called immunosenescence. That's just a fancy way of saying your immune defenses respond slower and less forcefully than they did at 30. It's not that your immune system stops working, it's that the alarm system takes longer to go off, and once it does, the response is weaker. On top of that, your gut lining itself changes with age. The tight junctions between intestinal cells, the ones that are supposed to act like a security checkpoint, become slightly less efficient. That means a parasite that a 30-year-old's body might beat back before symptoms ever fully develop can get a real foothold in someone who's 70. And there's a second issue that compounds this: dehydration risk. After roughly age 65, your body's thirst signal becomes less reliable. You can be meaningfully dehydrated before you actually feel thirsty. Combine that blunted thirst response with days of watery diarrhea, and you have a recipe for the kind of hospitalization the CDC's 9% figure is capturing. Let me tell you about a patient I'll call Carol, 68 years old, from a small town outside Dayton, Ohio, right in the middle of the outbreak zone. Carol came in describing what she called a stomach bug that won't quit. She'd had 2 weeks of loose stools, then felt fine for 4 days, then it hit again. Worse. She'd lost 11 pounds without trying. Her regular doctor had run a standard stool culture, completely normal, standard bacterial panel, and it came back clean because standard stool tests do not automatically screen for Cyclospora. You have to specifically request it. Once we did, and it came back positive. She was on a 5-day course of the correct antibiotic, and within a week, she said it felt like someone had turned the lights back on in her gut. That story is not rare right now. It is playing out in doctors' offices across Michigan, Ohio, Kentucky, Indiana, and West Virginia as we speak. All right, let's get into the 6 things that actually protect you, ranked from least powerful to most powerful. I want to be honest with you the whole way through. Some of these you already know, some of them will surprise you. Number one on this list, the most powerful, is going to change how you think about your grocery cart. So stick with me. Number 6, the dramatic truth here: the produce aisle is not as innocent as it looks, and washing is not the safety net you think it is. A 2026 Outbreak review from Johns Hopkins Medicine's infectious disease team is direct about this. Cooking kills cyclospora, but rinsing under water does not reliably remove it, and freezing doesn't kill it either. The parasite's outer shell, called an oocyst, is built to survive exactly the kind of splash and rinse most of us give a head of lettuce at the sink. Why does this matter more for aging bodies specifically? Because, as I mentioned, your gut lining's checkpoint system is running at reduced capacity. So, even a small number of oocysts that slip through your rinsing routine has a better chance of establishing infection in a body over 60 than in a body over 30. My practical tip: during an active outbreak, and we are in one right now through the end of August, since cyclosporiasis season in the US officially runs May through August, treat raw leafy greens, fresh herbs like cilantro and basil, and raspberries as cook or skip items rather than rinse and eat items. The synergy tip here: pair any raw produce you do eat with a squeeze of fresh lemon or a vinegar based dressing. It won't sterilize your salad, but the acidity does measurably reduce surface microbial load, and more importantly, it trains you to build a habit of treating raw produce a little more seriously during outbreak months. Number 5. Here's a truth that surprises almost everyone I tell it to. The standard stool test your doctor runs will very likely miss this parasite completely. Cyclospora doesn't show up on routine over and parasite panels the way people assume it will. Clinicians have to specifically request cyclospora testing, and the CDC's own health alert this month explicitly instructs doctors to specifically request diagnostic testing for cyclospora when it is clinically suspected. Why does this matter more for seniors? Because when an older adult reports vague, recurring stomach trouble, there's a well documented pattern in medicine where symptoms get attributed to getting older, to existing conditions like irritable bowel syndrome, or to medication side effects, rather than triggering a fresh, targeted workup. That's not a criticism of doctors. It's a reflection of how many boxes get checked when someone's chart already has three other GI related notes in it. My practical tip: if you or a loved one has watery diarrhea lasting more than 3 days, especially if it fades and then returns in a second wave, say the word Cyclospora out loud to your doctor and ask them to specifically order that test. It costs you nothing to ask, and it can save you weeks of unnecessary suffering. Pair that request with keeping a simple symptom log: date, time, severity, what you ate in the prior week, because that timeline is exactly what helps a clinician connect your case to a known outbreak cluster. Number 4. This one is about the quiet danger that puts people in the hospital, and it isn't the diarrhea itself. It's what the diarrhea takes from you. Dehydration in older adults is a genuinely dangerous escalation, and it happens faster than most people expect because, as I mentioned, the thirst mechanism weakens with age. Some research on aging and fluid regulation puts the decline in thirst sensitivity at a level significant enough that clinicians are taught to never rely on an older patient's reported thirst as an accurate gauge of their hydration status. Add in that many people over 60 are on diuretics for blood pressure, which further deplete fluids and electrolytes, and you have two forces working against you at once. Why this matters for aging bodies specifically: your kidneys also become less efficient at concentrating urine as you age, meaning you lose more water through normal function even before diarrhea enters the picture. So the margin for error is already thinner. My practical tip: during any bout of diarrhea lasting more than 24 hours, don't just drink water, use an oral rehydration solution with the right balance of sodium, potassium, and glucose. Because plain water without electrolytes can actually worsen the imbalance in some cases. Sip small amounts every 15 to 20 minutes, rather than large amounts all at once, since a stressed gut absorbs frequent small sips far better than it absorbs a full glass in one go. The synergy tip: pair your rehydration solution with a small amount of easily digestible starch, plain rice, a banana, dry toast, because sodium and glucose actually enhance each other's absorption in the small intestine, which is the entire mechanism behind why oral rehydration therapy works in the first place. This is exactly the kind of thing I built this channel to tell you plainly, without the fear mongering and without the fluff. If that's useful to you, hit subscribe and tap that like button right now before I continue. It genuinely helps this information reach the next person scrolling past who needs to hear it. Maybe someone your age, maybe someone you'd forward this to. Alright, let's get into the top 3 because this is where it gets serious. Number 3. Here's the part that genuinely catches people off guard. Your body's ability to repair itself after an infection like this is not what it was 20 years ago. And that has almost nothing to do with willpower and everything to do with the phenomenon called anabolic resistance. Anabolic resistance simply means that as you age, your muscle tissue becomes less responsive to the protein you eat. Your body needs a larger protein stimulus to trigger the same amount of tissue repair that a smaller amount would have triggered in your 30s or 40s. During a prolonged bout of diarrheal illness, you're losing protein, you're losing appetite, and your body is trying to repair a damaged intestinal lining, all while its repair machinery is already running at reduced efficiency. Why this matters specifically here: the intestinal lining itself is one of the fastest turnover tissues in your entire body. It renews itself every few days under normal conditions. But that renewal is protein dependent. And if you're not eating enough usable protein during and after this illness, that repair slows even further, which is part of why some patients report feeling off for weeks after the acute diarrhea resolves. My practical tip: once you can tolerate food again, prioritize easily digestible protein: eggs, plain yogurt, soft poultry, a whey protein shake if dairy agrees with you, aiming for a meaningfully higher intake than you'd normally eat, spread across 3 to 4 smaller meals rather than crammed into one, because aging guts absorb frequent moderate protein doses better than one large one. The synergy tip: pair your protein intake with light movement as soon as you're able, even a short walk, because muscle activation itself increases the sensitivity of your muscle tissue to protein's repair signal, meaning the same amount of protein does more work if you've moved your body that day. Number two, this is the one most people over 60 get completely wrong, and it costs them weeks of misery they didn't need to have. Cyclospora is not one of those infections you simply wait out. Unlike many viral stomach bugs, this one is treatable with a specific antibiotic, trimethoprim sulfamethoxazole, and Johns Hopkins Medicine's clinical guidance this year is explicit that while some infections may resolve on their own, treatment is recommended for all confirmed cases, particularly for anyone immunocompromised, where the guidance is even more urgent. Why does this matter more for aging bodies? Because chronic inflammation, something researchers call inflammaging, the low grade, persistent inflammation that tends to build in the body as we age, means an older immune system is already running a partial background workload before this parasite ever shows up. Adding an unresolved parasitic infection on top of that baseline inflammation doesn't just prolong your symptoms, it can aggravate other inflammation sensitive conditions many people over 60 are already managing, from joint pain to cardiovascular strain. This is why just riding it out is a fundamentally different and riskier decision for a person my father's age than it is for a person my son's age. My practical tip: if you're diagnosed, take the full course of antibiotics exactly as prescribed, even after you start feeling better, because stopping early is one of the most common reasons for that remitting relapsing pattern to continue. The synergy tip: ask your doctor about pairing the antibiotic course with a probiotic taken a couple of hours apart from your antibiotic dose. Not at the same time, since that reduces the antibiotic's effectiveness, to help rebuild the gut flora that both the infection and the treatment will have disrupted. Now, number one, the most powerful thing on this entire list, and I promised you this one would surprise you. It's not a supplement, it's not a medication, and it's not even something in your kitchen right now. It's a habit of mind, source awareness. Right now, in the middle of an active, unresolved outbreak where investigators have not yet identified every contaminated source, the single most powerful protective action is treating raw produce during outbreak months the way a person with a nut allergy treats an unlabeled dessert. Not with panic, but with a default assumption of caution until you know more. That means, specifically through the end of August, prioritizing cooked vegetables over raw salads when you're eating at restaurants using pre washed, pre cut produce, being especially cautious with raw cilantro, basil, raspberries, and shredded lettuce specifically, since those are the exact categories with the strongest historical link to past US cyclospore outbreaks, and checking your local health department's website for any active recall or restaurant specific advisory in your state. Since the CDC's investigation is actively narrowing down sources as we speak. Why is this ranked as the single most powerful item? Because everything else on this list, the hydration strategy, the protein timing, the antibiotic course, is damage control after exposure. This is the only item on the list that prevents exposure in the first place, and for a body with reduced immune reserve and slower repair capacity, preventing the infection entirely is worth more than any recovery strategy after the fact. Think of it like the difference between wearing a seatbelt and getting excellent emergency room care after a crash. Both matter enormously, but only one of them keeps you out of the emergency room to begin with. I want to tell you about one more patient, a gentleman I'll call Walter, 74, from a suburb outside Louisville, Kentucky. Walter had lived through plenty in his life: two knee replacements, a heart stent, decades of being what he called tough as an old boot. He told me he'd never once in his life cancelled a family barbecue because of a stomach ache, and he wasn't about to start. But 3 weeks into a cyclospora infection he didn't yet have a name for, He missed his granddaughter's birthday party because he couldn't be more than a few steps from a bathroom. That's the part that got to him. Not the diarrhea itself, but what it took from him: the independence, the ability to just show up for the people he loved without his body vetoing the plan. Once he was properly diagnosed and treated, he told me the thing he was most grateful for wasn't feeling physically better, though of course that mattered. It was getting his calendar back, getting to say yes to things again without negotiating with his own gut first. And that really is what this whole conversation comes down to. This isn't about fear. I don't want you walking away from this video afraid of salad. I want you walking away from it informed, because informed is the opposite of afraid. The years after 60, after 70, after 80 are not years to be managed around illness. They're years to be lived, and lived on your own terms, showing up for birthdays and Sunday dinners and long walks with your grandkids without your body pulling you aside and telling you no. Quality of life at this stage isn't a luxury, it's the entire point. And protecting your gut, your hydration, your immune resilience isn't about chasing youth backward. It's about protecting your ability to say yes to your own life. It is never too late to build these habits. Never too late to ask your doctor the right question. Never too late to pay a little more attention to what's on your plate. The body you have right now is remarkably capable of healing when you give it what it needs at any age. If this video helped you understand something you'd been genuinely confused or worried about, do me a favor and subscribe to this channel. I put out content like this every week, always grounded in real research, always written for you specifically, not for a 25-year-old. And I want to hear from you in the comments. Have you noticed changes in how your body handles stomach illness compared to 10 or 20 years ago? And did anything in this video make you rethink how you'll handle your next grocery run? I read every comment and I answer as many as I can. Take care of yourselves, and I'll see you in the next one.